So, what is tennis elbow really? Let's dig into what this pain actually means and why it happens. You feel pain on the outside of the elbow, that bony knob called the lateral epicondyle. It often involves tendon irritation and tiny tears. Repetitive wrist and arm use phrase the tendons that attach your forearm muscles to bone. Inside, 3 bones meet: the humerus, the radius, and the ulna. Extensor muscles that straighten your wrist and fingers attach via tendons to the lateral epicondyle. The ECRB tendon is commonly strained and becomes painful with overuse. The ache can travel to your wrist and make gripping, turning a doorknob, or lifting a mug difficult. Good news, tennis elbow is treatable. Pinpoint the source and we can calm and rebuild the tendon. So why did this happen to me? The common culprit is repetitive wrist and forearm motion. Plumbers, repeated gripping and twisting. Painters, repetitive wrist movements. Carpenters, forceful, repeated actions. Cooks and butchers, constant chopping. Tools like screwdrivers and hammers stress the same tendons. Hobbies, gardening, knitting, instrument playing can all contribute. Poor workstation ergonomics, long mouse use with a bent wrist, increases risk. Most common between 30 and 50, tendons lose elasticity with age, or a single sudden contraction, like starting a mower or lifting an unexpectedly heavy box, can tear tendon fibers. Bottom line, tennis elbow can happen to anyone. Know your risks and take early steps to prevent it. When pain first strikes, your goal is to calm inflammation. Start with rest. Stop the activity causing the pain. No sling or weeks off needed, but stop aggravating actions. Apply cold to reduce swelling and numb the ache. Commercial pack or bag of frozen peas works. Never place ice directly on skin. Use a thin towel and apply for 15 to 20 minutes several times daily. OTC NSAIDs like ibuprofen or naproxen can reduce pain and inflammation short-term. Follow directions and check with a pharmacist or doctor. They don't fix the root cause. They help manage symptoms while you heal. See a doctor if you have severe pain, can't do daily tasks, or no improvement after 1-2 weeks of rest and ice. They'll confirm the diagnosis and may discuss physiotherapy, injections, or other options if needed. Early expert care speeds recovery. Don't tough it out alone. Referral to physio is common and helpful. Once sharp pain eases, it's time to move carefully into rehabilitation. Physiotherapy guides safe stretching and strengthening to rebuild tendon resilience. Wrist extensor stretch. Sit, rest your forearm on a table, palm facing down. Let the hand hang, then gently use the other hand to bend your wrist down until you feel a mild stretch. Hold 30 seconds, relax, repeat 3 times, wrist extension strengthening. Rest forearm palm down and hold a very light weight. Slowly lift your hand by extending the wrist, then lower slowly. Control over speed is key. Aim for 3 sets of 10. If it hurts sharply, stop or reduce weight. Supination exercise. The motion of turning the palm up like a doorknob. With elbow bent, hold a light weight vertically. Rotate slowly so your palm turns up then back down. 3 sets of 10. This isolates and strengthens the supinator. Grip strength. Use a soft stress ball or rolled socks. Squeeze gently for 5 seconds and relax. Repeat 10 to 15 times. Do these exercises gently every other day. Consistency rebuilds strength and flexibility. Congratulations, recovery is a marathon, not a sprint. The final lap is prevention. If you play racket sports, check technique with a coach. Small changes reduce elbow stress. Set up your workstation so wrists are neutral and supported. Use 2 hands for heavy items and lift with palms up to engage your biceps, not just forearms. Do a few minutes of wrist stretches before repetitive tasks. Think of it as maintenance for your muscles. Keep doing strengthening exercises even after pain improves. It's your insurance against recurrence. If a task triggers pain, change methods or tools and take frequent short breaks to stretch. Be proactive. Listen to early warning signs and rest before it gets worse. Small victories matter. Lift your coffee cup without wincing. Returning to activities is possible with patience. Treat correctly, follow a plan, and prevent relapse. If this helped, subscribe for more step-by-step rehab guides.